Confusion remains over the who, when and how people can get the vaccine. 1 million more Pfizer doses will arrive in July, which will be just in time for the general population, those in Group 4, to get vaccinated. Currently, those in Group 3, which is everyone aged 65 and above or who is pregnant or have an underlying health condition, are eligible to get vaccinated. But many in the category say they're yet to be contacted about getting the jab, and general practitioners say there needs to be a clearer set of guidelines in place. For more on this, we're joined by Dr Vanessa Wienink, the Chair of the General Practitioner Council at the New Zealand Medical Association. Morena.
Morena, how are you?
Yeah, really good. Thank you so much for joining us this morning. We really appreciate it. Is it your experience that this rollout has been somewhat confusing?
Patients are definitely finding it confusing, and GPs across the country are having to have these conversations with people pretty much every day, repeatedly, about, when am I going to get the vaccine? And most of us are saying you'll get it when you'll get it, basically.
Yeah, well, you can't give any information if you don't have it, right? So what are the conversations, those are the conversations that GPs are having with patients. What are the conversations that medical staff are having with one another about this rollout?
Yeah, well, we are also confused about when we're going to be, if we're going to be participating, if there's going to be a collaboration with pharmacists around us, whether or not there'll be a local hub, or whether or not there'll be mobile units going out to some communities and things like that. So some of my rural communities are uncertain whether the GPs there will be participating, or if it's just going to be sort of taken to them. It's been confusing for us as well as the public, I think.
Yeah. Dr Wienink, we've actually had some feedback already this morning from people who are talking about the vaccine. I have COPD, have not been contacted. Family members had a lung transplant, no contact yet. Tracy says neither of my elderly parents have been contacted, read their vaccinations. They're 93 and 89. So, I mean, there is the confusion, but part of that confusion is around each DHB doing a rollout. I guess they're in charge of their own rollouts and what that looks like, and that's different for each DHB, right?
Yeah, that's right. So we've got 20 different systems. And one of the things is that this is showing is that we really need to have a central operational health unit, and that's what the health reforms are going to be doing, and having a operational Health NZ running these kinds of operational practices, rather than the Ministry of Health, which is not exactly experienced in that sort of thing. They're more of a policy unit. So when it comes to this sort of thing, the planning that they've done centrally is one level of planning, but then the actual day-to-day, how is it going to be done in each district is completely different. And that is causing confusion, and especially when people say, well, my auntie down in Nelson's had already had her vaccine, but, I'm a health worker wherever and I still haven't had my first one, so all those kind of things are causing confusion as well.
What we do know is that the latest shipments have been locked in. We're expecting more doses to arrive in July. So the general public will start their vaccinations in July. Based on what we know already, do you think we're ready?
I think it's going to be a very challenging time. I think it's going to be confusing. And the thing is that if it's done in a nice sequenced way, then it can feel like everything's very orderly, but it's going to be quite challenging to do that in a sequenced way across the country all at once. So I think that once the general public rollout starts to happen, we'll need to have many more places doing it. There'll need to be pop-up centres and mass vaccination events, and hopefully more GPs will be able to be involved. And since the storage capabilities of the vaccine have been not so complicated now, that should actually be more simple. We still just haven't heard, many GPs haven't heard what's their place in it. And overseas, when GPs have been involved, that's when it's been really successful. For example, in the UK, about 90% of their vaccines have been delivered through GP practices. And also in Israel, that's been mainly delivered through their health networks, which are basically essentially primary care networks.
Communication is obviously an issue. How can this be done well from this point on? How can we get it right?
Well, it is actually quite simple for GPs to be able to communicate with their patient populations, and about 95% of our population are enrolled with a general practice. So a decent proportion of people would trust the communication that comes from their GPs. The only thing is that most of us aren't going to be involved directly with that, or haven't been told how we're going to be.
I don't want to put this on you, but here's the question. Is this the DHB's issue, or is it the MOH's issue?
I think it's probably the DHB's, to be honest. They're the ones who've been given the responsibility. They've also been limited in how they do that by the Ministry of Health, so they've been given limitations on how they do it.
But have they been given all the information to be able to deliver the correct communication?
I'm not certain that I can answer that question, but it seems that it has been inadequate for people.
Dr. Vanessa Wienink, we really do appreciate